The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello, I'm Kate Ball and I'm the founder of Mini First Aid, and welcome to our podcast Family Health by Mini First Aid. Now, I'm delighted that you've taken the time to listen to our podcast, because whether you're in the car, you're having that opportunity to clean the house, or maybe even relaxing with a cuppa, our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm just going to Google it, have a listen to us instead. Now, today we are in Series 5, which is so exciting, and I'm thrilled to invite back one of our guests from Series 4, Dr Lillie Parker, who shared her expertise on coughs and colds and chickenpox with us in the last series. So for our new listeners, if you've not met Lillie before, then Lillie is an NHS paediatrician with over 10 years experience working with children. So she is expertly placed to guide us through our topic today. Lillie, we're talking about head injuries today. Welcome back, Lillie.
Thank you so much for having me, Kate. It's always nice to chat.
Now, it's a bit of a biggie for every parent, because as much as we try and wrap them up in cotton wool, our littlies are going to get a bump, right? It's going to happen, or they're going to get a knock to the head at some point. And it's really important to know what to do, isn't it?
Yeah, absolutely. And at the moment, I'm working in children's A&E. That's my career trajectory, is to hopefully be a children's A&E consultant. And in A&E, we see children every single day with head bumps, if not multiple children. You know, I don't think I've gone through a shift in the last 6 months without seeing one. So it's something that's really common, but also something that gives parents quite a lot of anxiety. And therefore, if it is something that you're inevitably going to have to face, I think it's really helpful to know just a little bit about when to worry and when to be more reassured, because children will bang their heads on things.
Totally. So let's dig in a little bit more detail, because I think, as you've said, you see so many cases, and I think most people listening along will say, gosh, yes, this has happened to me, or they're fearful of it. But let's start off with that big question, because why have we got to be so careful about head bumps as opposed to perhaps bumps and scrapes on maybe other parts of the body? What's so important about the head?
So I think, to break it down into really simple terms, our head contains our brain, and our brain is possibly our most important organ. I'm sure other doctors might argue there are more important organs, but without your brain, you can't control any of your other organs in your body. And if you damage your brain too severely, then you won't survive it. So I think your head is a large part of your body. It is the part of your body in a child that is possibly most likely to be hit against something or against the floor. And because you have this soft organ inside a hard box, it is particularly vulnerable to injury. Now, the skull is designed to protect the brain. That's why we have our skull, and it's a hard kind of bony box to try and protect it. But the problem is that the brain doesn't really have anywhere to go if there is swelling or damage, and therefore even relatively minor when we're looking, relatively minor injuries can cause swelling and damage to the soft brain inside the skull. So it can be a real range. You know, we can have head injuries, anything from a small scrape on a forehead all the way up to significantly traumatic skull fractures and big injuries that we will see in the emergency department. But right. Even a relatively minor fall can actually cause some damage. So it's just helpful for parents to know the signs of the damage, because the range of injuries is so broad. And I've seen children have really big injuries or looks like really big injuries and actually come away with nothing, and other children who have had relatively minor, inverted commas, minor falls and have more serious head injuries.
So we're going to talk about those in just a second, but just
Yeah.
when you were talking about A&E and the fact that you said that you see a lot of children coming to A&E with head bumps, are there any statistics? I mean, are my children outweighing all the other statistics? Like because we seem to be, it seems to happen to us a lot, or is it, is it high numbers? What sort of statistics do we have on children going to A&E with a head bump?
So we know about 500,000 children a year present to A&E or minor injury units with a head injury. So it is a huge amount. And as I say, I think probably if you looked at the statistics of our department, we're a relatively big department, it would be unusual to see less than 5 to 10 children every day with head injuries.
Wow.
And so it is literally bread and butter of what we do and what we see. So we get really good at assessing head injuries, and often I can assess a child from across the waiting room and know if they have a serious head injury or not. Obviously, I do a more thorough assessment than that, but I think you get an intuition for when to worry and when to not. But for parents, it may be something that only happens once a year, less than once a year, and therefore it's more worrying for them, and they want that expert opinion, so they bring them to an expert.
When you're asking that question, and I know I've been asked it, and I'm sure many parents say the same, and they say, how did it happen? Do you have a document that you go actually, and so that you can have a statistic on what causes head bumps, or just anecdotally, what causes the majority of these head bumps?
I mean, it will be anecdotally at the moment, I think, but in essence, a huge range of things. Toddlers, they just fall over. When they're learning to walk, they just fall. Whether it is down a step, whether it is on the flat, whether it is that they've walked into a door or something that they weren't looking at. We know that toddlers, when they're learning to walk, they're not very good at paying attention to where they're going. They're a bit unsteady on their feet. And actually, if you look at a toddler's body, their head is disproportionately big compared to the rest of them. When they fall, they're very likely to hit their head, and they're not very coordinated to put their hands out to stop them from hitting their head on things. Whereas as you get older, you get better at trying to protect your head. So you will put your hands out or try and fall in a certain way so that you don't hit your head. So when we get into the older children, they're much better at naturally protecting themselves from head injuries, so they will get a lot more arm injuries, wrist injuries, because you do put your hands out in front of yourself to protect yourself. But in those older children, we start to see more scooter injuries, bike injuries, even motocross in teenagers, or motorized vehicle injuries. And then we see road traffic accidents, children crossing the road, unfortunately get hit by a car or a bike or whatever it is. And unfortunately, we do see a lot of children who are not adequately protecting themselves against head injuries, which I think we can talk a bit about later. And also, you get more adventurous as you get older, don't you? So children will become more adventurous. They start climbing up things. They climb up climbing frames, up walls. I think this week I saw, a child fall off a wall, a child fall off a climbing frame, a child fall out of a tree. These are things that are normal and for adventurous kids to do, but occasionally they will fall, and your head is one of the parts that you might hit on the way down or when you land.
I can clearly remember when it first happened in our family, and my little boy was 18 months old, and he, as you said, when you were talking about the very little ones, he just fell over walking along in our hallway, and my husband and I went, how did that happen? And then you go and you have to give we decided to go to A&E because we were concerned, because we didn't know, we saw this big lump on his head, which we'll talk about in a minute, but we didn't know what we were supposed to be looking for. And that leads me on to this question about concussion, because parents, families, carers, etc., might be going, oh gosh, I'm really concerned about concussion. Does every head bump give concussion? Does it result in concussion?
No.
Okay.
So not every head injury results in concussion. Concussion is, in essence, what happens when the brain has a relatively significant knock. But again,
Okay.
it is a spectrum. You can have a mild concussion or you can have a really severe concussion.
Right.
The way I often describe it to families is like we started with. The brain is this soft organ that sits inside a hard box. And when we fall and hit our heads on something, that soft organ gets shaken around inside this hard box. And it will, in essence, hit the skull forwards and backwards often when you actually hit the floor or whatever it is that you've fallen and hit. And that movement of the brain inside is something that it doesn't really enjoy. It causes damage to the cells, the neurons, stretching, swelling of the brain cells. And that can sound quite scary. It can be minor, but it also can cause symptoms where the brain is basically struggling to fully function as normal for the next 24 hours, anything up to the next few weeks or months.
Okay.
And that damage to those cells will cause the most common symptoms we see of concussion. So things like short-term memory loss, confusion, headaches, feeling sick, difficulty concentrating at school, difficulty concentrating maybe on the things you would normally do at home. And whilst much of the concussion we see is not life-threatening, it will settle down and that kind of brain tissue will recover with time. I think a lot of people say the phrase, oh, it's just a concussion, or I just got a bit of concussion. And actually, it can be a relatively serious thing, and it can really affect children or teenagers for, as I said, anything for a few weeks to a few months after a serious head injury. So it's not something to be taken lightly. But equally, lots of children do fall over and hit their heads and don't end up with any of those symptoms. So it doesn't happen all the time.
So what about, obviously you've talked about symptoms there, and I guess some of those you might be able to ask a question to say, does your head hurt? Or, ask a question that might help you understand about memory loss or what have you, or do you feel dizzy? What about little ones where they're not able to talk yet or really articulate how they're feeling? How on earth do you spot if a baby or a toddler has concussion? How do you figure that one out?
It's really hard. And I appreciate that probably the majority of children we do end up seeing with head injuries are the smaller ones because they are more difficult to assess. If you have an 8-year-old, they're going to be able to tell you if they have a headache, if they feel sick. You're going to be able to have a little bit of a conversation with them and know if they're talking complete nonsense or if they don't remember what's happened or what you had for lunch. Whereas if you have a 1-year-old who's fallen, and as I said before, it's really common for that age group to fall, they can't tell you. But there are subtle signs. They are much more likely if they've got a headache or they're in pain, they're possibly going to cry much more. They're going to be more clingy and irritable, not wanting to be put down, wanting to be held all the time. They might be much more sleepy than normal. So again, it's difficult in little ones because they often nap and they sleep at night, and these things inevitably happen just before you're about to put them to bed or something like that. But if they're really sleepy at a time when they would normally not be sleepy, the vomiting is universal. So children may vomit at any age, and that's a relatively easy cue to pick up on. But actually vomiting is probably one of the least specific signs for us as health professionals of serious head injury. So it's the one that a lot of parents will fixate on. But for us, there are other signs that are more worrying. So it's that pain, the lethargy, maybe not being themselves. If they're usually able to walk around, not wanting to walk around, or being really unsteady on their feet, more wobbly. But I think it can be tricky with the little ones.
I remember distinctly being asked a question about, is this normal for your baby? Because I guess as a parent, you know your child better than anybody. And therefore, you can say to the doctor or the healthcare professional, whoever you first see at A&E, actually, no, this isn't how they normally behave, because then I guess that's going to give you a little bit more information.
Absolutely.
Can you treat...
some children will only nap for 20 minutes and other children will nap for 2 hours. And if you come in and say, well, my child's had a 2-hour nap, that doesn't give us a huge amount of information. But if you say they never sleep for that long in the day, they knocked their head and then they had a 2-hour nap, and usually they would only sleep for 20 minutes, then that tells us that maybe they were more sleepy than they would normally be.
So should we, with these sort of more, I guess, maybe a minor concussion, should we just be treating that at home, or should we be coming to hospital?
It's really difficult to assess, but there are some kind of guidelines as to when you should definitely be coming to hospital. So I think some of them are in terms of how your child hurts themselves, because there are certain, what we call the mechanism of injury, which is how something happens. And there are certain mechanisms that concern us more. They're more high risk for significant head injuries or other injuries. And then there are signs that you can look out for. So in terms of the mechanism, if your child falls more than their own height from standing, or higher than a meter, whatever is less. So if they are less than a meter, if they fall higher than they are tall, or if they are more than a meter, if they fall from a meter or higher, or if they fall down more than 5 stairs, they should always be seen by a health professional. And that's just because that level of height creates a level of risk that even if they look okay to you, there may be something underlying. So, and that guidance is, you can find that on the NHS website or on Healthier Together.
Okay, because presumably that risk is that the length, the impact, because they've fallen from such a particular height. Okay.
And it's about that wobbling of the brain and the risk of fracturing the skull when you fall that level. And obviously it depends a little bit on what floor they fall onto. You know, if they fall onto a playground floor that is designed to take impact, it's wood chip or it's rubber, it's going to be a little bit different to if they fall onto a wooden hard floor, and how they fall. But the generic guidance is if they've had that level of impact, well, they should just get checked, because you may not miss the subtle signs. You may not see all the signs. And then in terms of the other thing is if they were traveling at speed when they came off something and hit themselves. So the classic is like a child who was on a scooter on a ramp or on a bike. I've seen a lot of, since the weather's become a bit nice, a lot of BMX bike injuries. Again, some children will be wearing helmets. Some children sadly aren't wearing helmets when these things happen. And then in terms of the more worrying signs, I think if they have a massive cut on their head, you're going to automatically bring them to A&E, aren't you? You know, if they've got a big laceration, equally if they have a big bruise bigger than 5 centimeters across, or a big, huge egg that's a bump that you're not sure if it. The description often is if they have a boggy swelling. What that means to people, I always think that's really difficult, because the majority of swelling is boggy.
Right. Okay.
What they mean is that if it feels jelly-like, and the reason that comes up is because if you had a skull fracture, then some of the fluid inside the brain would leak out and would make it feel potentially, you may even feel the fracture line underneath, but actually a lot of swelling does feel soft and jelly-like because it is fluid in the tissues. So I'm not sure that one is that helpful, but if they have a really big swelling on their head, then I would get that checked out by a health professional. Equally, if they knock themselves unconscious, then they should be seen, even if they come round and you think they're totally fine. If they've had a big enough impact to knock themselves unconscious, then they should be seen. And then there are signs that may come on later that you should be looking out for. So if they're confused and continue to be really confused, if they vomit more than 3 times, and that's the important one, if they vomit more than 3 times, more than 10 minutes between each vomit, because often children will vomit at the time of the injury from the shock or the pain. But what you're worried about is more vomiting because of a head injury rather than because of shock or pain. So if the vomiting is ongoing and continues over a period of time, if they are severely drowsy, which we've touched on, if they are not able to speak or interact with you in the way that you would normally expect them to for older children, or if you start to notice that they've got bruising under their eyes, behind their ears, or any fluid coming out of their ears or nose. And again, in toddlers, they always have fluid coming out of their nose. Always, continuously. So I appreciate that one's also quite difficult because you wouldn't necessarily be able to differentiate snot. But the reason for that is, again, if you have fractures of the skull, you can have leaking of the fluid from inside the skull out. And actually there are links to the nose and the ears. So it's the brain fluid coming out. but that is one that I've actually never seen in a child that hasn't been brought in by an ambulance through a serious
Okay, all right. So this is less likely to be the fall on
something
your
you would
hallway.
just pick up without any
sure.
other signs. Like the likelihood of that is very small.
Okay, so talking about as a parent or carer being concerned, and you talked about the egg or the lump that appears on the head or some of those symptoms, where do we go? Because we've talked about seeking health advice, and there is this bit where it's difficult sometimes to see your GP. It's also sometimes a worry that, do I go to A&E because am I wasting time ahead of somebody that's more, needs more critical care than me? Where do you go? What's your advice? Where should parents be heading after a head injury with their children?
So if you're a little bit worried but not majorly worried, I would see if you've got any minor injuries departments around you. The minor injuries units are brilliant. They will see the majority of kind of day-to-day injuries, and it avoids sometimes the really long wait times in bigger A&E departments where they're dealing with ambulances and other things. But I appreciate in the country, some places have really good minor injuries units and other places they're pretty sparse and far between. Your GP is probably going to be able to give you very limited advice when it comes to head injuries. The majority of GPs will, if it's an acute injury, it's happened in the last kind of 24 hours, they're going to direct you to A&E. If it's a more long-standing thing, as in if the injury happened maybe a few weeks ago and you're more worried about the longer-term impact, then yes, your GP may be helpful. But for an acute injury, it's going to be a minor injuries unit or an A&E. And if you're not sure, you can call 111 and ask for some advice.
Okay.
I would say the majority of people who call 111 will be directed to go to A&E. So don't be shocked if you actually call them and you say, I think they look fine, but they've had a fall from a climbing frame, and 111 say, you should probably get them checked out, go to A&E.
Okay, yeah.
Because they can't see your child, they can't assess your child on the phone. So they will on the side of cautiousness. And if the mechanism is at all worrying, and as I said, sometimes even just falling from standing in a toddler can cause concussion. So they probably will say go to A&E. And we will never criticise you for bringing in a child with a head injury, because we know that although it is a very small proportion who have anything serious, the risk is high. As we said, you only have one brain. It's really important, and parents don't necessarily feel confident in assessing them at home. And so you're not wasting our time. It is something we see every day, and it's one of the things that I never really say to parents, or why did you bring them? You didn't need to bring them here.
Lily, that's really reassuring. Thank you. Now, children have also a habit of falling over. You talked about schools actually, when the children fell over in the playground, but it's common, isn't it, that you get to your child's place of childcare, whether that's nursery, school, preschool, etc., and there's been a head bump at one of these settings. How should that be managed, or what sort of information exchange needs to happen when there's a head bump at a child's place of childcare?
So what I would say is good is that most nurseries and schools are quite cautious when it comes to head injuries. So if it is a significant head bump, or they're worried that your child has any worrying symptoms, they do get some training in that, and they will send your child home, or they will call you and ask you to come in. So if you haven't heard about it until you pick them up, it's probably going to be a relatively minor head bump.
Yeah, okay.
However, I think it's important just to ask some basic questions about how it happened. When we talked about the height being really important, I think it's important to know where your child was. Did they fall from standing? Lots of children will fall backwards off a chair or something like that. Like, was it a big chair? Was it a little chair? Was it one of those mini nursery stools, because that's actually not that high? Or had they climbed up on an adult chair and fallen backwards? Those kind of details make a difference. And then ask them what they were like at the time, what they've been like since. Have they gone back to their normal self? Have they been playing? Have they eaten and drunk something? Have they been in pain? Have they been a bit quiet? Some nurseries will give Calpol, some won't, but have they had to give anything? Have they had to take them out and sit them somewhere quiet for a bit? Those kind of bits of information. So rather than just saying, yeah, that's fine, we'll go now, just ask a few basic questions so that if you did end up having to go to A&E later, you would have an idea of what happened.
We have these fantastic bump notes at school. I know because I have many of them. My children. There's always one in the book bag, most days, which sort of tells us what happened, and is signed by first aid. And I know that, from a first aid arm, when we're training childcare professionals, it's very much a case of anything that happens when there's been any sort of injury has to be documented, both in a first aid book, but also then to the parents, and that decision as to whether it's a contact the parent straight away once you've given the basic first aid, or whether it's whether it's a little bit whether it's a little bit more of a complex conversation that you had to have.
And
I guess
sometimes, unfortunately, teachers don't see. They don't see what happens, or children are running around and two children hit heads. And
I was going to say children bumping into each other. That's really common, right? Yeah.
I had a child the other day who came in and he'd been at like a holiday camp, and he said he'd hit his head, and Mum was worried when she picked him up, but actually the team said unfortunately they didn't see exactly what happened. They saw him when he cried afterwards, but they didn't see it. And I think he was about 6 or 7, so he was able to tell me, but he also couldn't quite maybe eloquently put what had happened. So he said, I ran into a piece of equipment. And I said, what do you mean by equipment? And he said, something like a piece of equipment. And I said, well, what did it look like? Was it wooden? Was it metal? Is it a pole? Like, was it on an assault course? And he just couldn't, he didn't know. He couldn't tell me. And unfortunately, the staff couldn't tell me. And Mum was really worried that he couldn't tell me. And I wasn't sure if he couldn't tell me because he had a serious head injury when he'd done it, or because he just didn't have the vocab to kind of describe what he was seeing. So sometimes it is a little bit blurry, but actually there were no other worrying signs on this child. So I put it down to being a 6-year-old and not really knowing how to describe what he had run into. Maybe it was a pole or something.
Yeah, it is, and it is tricky, isn't it, with children, because in a childcare setting, you're quite right. Even if they're taking beautiful care of your children, something that happens in a flash can happen, and you could just at that moment be dealing with another child, and then only hear them cry. We always find in primary schools that the surrounding children are quite helpful, so they will tell you. You quite often will get a circle of children that will all very willingly tell you, but even their version of events can be different. But so I would guess also on that, when you talked about communicating, so that the childcare provider is communicating back to the parent or the carer to say this has happened, etc., etc. I would assume that because of this ongoing risk of concussion, that if we've had a head bump at home, it would probably be helpful to communicate the other way if we're perhaps dropping a child off at school, having had a head bump before they got to school or before they got to nursery or what have you in the morning. Is that a good idea? I mean, that's something that I tend to do. If we've had something that happened at home just before we leave, I tend to communicate it on.
Yeah, absolutely. If they bump their head on a Friday evening and you're dropping them to school on a Monday morning and they've been completely fine since, it's probably a bit less important. But if they have fallen off their scooter on the way to school and bumped their head quite hard on something, or been playing in the playground just before you came and fallen off something, I think it is important for school to know, because children vomit and have headaches very commonly for a whole host of different reasons. And if a 7 or 8-year-old says they have a headache on a normal day, I imagine that school may just give them a little bit of medicine and sit them in a quiet room and see if it gets better, and if it does, get them back to class. But actually, if they have a headache and they've had a serious or even a minor, head injury that day, they're going to be more worried. They're going to call you and let you know as their parent or caregiver. And that's something that you would want to know about. So I think it's important.
Yeah, absolutely. And I've got a few things to talk about here when it comes to sort of when it comes to preventing, because it's always the case that we've talked about what it's happened, and you've gone to A&E, and on our mini first aid classes we talk about 10 minutes with a cold compress, and then checking for signs of concussion, and then making a decision if we're going to go to A&E. But I guess it would be good. I know things, we started, didn't we, at the front end of the podcast saying you can't wrap them up in cotton wool. Things are going to happen. Heavy, these big heavy heads that these babies have, and the ratio in their body and all of those sorts of things. And
top
the fact
heavy,
that they're
disastrously top heavy. Yeah, who designed that? Anyway.
Yeah, it's bonkers, isn't it? So it's sort of stacked against them. But there will be accidents, head injuries in particular, that we're talking about today that could be prevented. Is there things that you would say that you would love for parents to hear from you around helping prevent head bumps, head injuries?
Yeah, so I think in smaller babies, it's being aware that babies sometimes do things that you're not entirely expecting.
Okay.
And in particular, I mean, your 6-month-old who you don't think can roll yet, but then spectacularly manages to roll off the side of the changing mat, which is on top of the chest of drawers or the bed or whatever it is.
Okay.
I think as a paediatrician, I would probably just never change my child on any high surface at any point, because even in babies who can't roll, they can still kick their legs and shuffle, and sometimes they will slide in places and move, and it can be as simple as you've put them on the side of the bed on a changing mat and they just kick their legs a bit and then they kind of slide off. And so I would be very cautious of putting them on a high surface, but especially when they are getting to the point where they're going to hit those developmental milestones and start to be able to move more. It's one thing in a newborn baby, but in a 5-6 month old baby, it's a little bit more high risk, I would say. And in the same way, strapping your child into a high chair, because you never know at what point they're going to be able to climb up or stand up in their high chair.
Yes.
And a lot of children will fall out of high chairs or fall backwards from high chairs. So it's just having that little bit of awareness and probably taking the precautions in smaller babies. Some parents will take this to the extreme and be really worried about head injuries and do things like corner protectors on all the door frames and, stair gates are helpful, but I've also seen children climb over stair gates and still fall downstairs. And so I think there's only so much you can do, potentially, if you have a really dangerous set of stairs and you're worried. Yes, a stair gate can be helpful, but don't consider them completely child-proof at all points, because they're not. And I think the two ones that I constantly bang on about are helmets for children of all ages, any age who is on any kind of wheeled device, be it a scooter, tricycle, bike. If they are going on wheels, they have to wear a helmet. And if they're not prepared to wear a helmet, my line would be they don't go near it. But then I have seen the consequences of children not wearing helmets. And I also appreciate that when children get older and they have more autonomy, especially teenagers, it can be a real battle. But I, every week, see children, especially older children, where parents maybe aren't able to force them, that kind of 13-year-old, who don't wear helmets and come off and hit their heads. And the other one is mesh round trampolines, that you can get the mesh wall ones. I think that's really important, because I see a lot of children who bounce off the edge of trampolines.
They've literally bounced off. Oh my gosh. Wow.
Yeah. Bounced off, or their big brother or sister has double bounced them, or they've collided on the whatever it is. Trampolines are a little bit dangerous in general, but I appreciate they're also good fun and they're quite good exercise. I do see a lot of injuries from trampolines, and I think if you're going to have one, either sinking it into the floor if you can afford that, which is a very nice way, or making sure they have a mesh around them so that if they are raised, they're not going to fall off or fall backwards off them.
It is amazing the number of children that you see on bikes and scooters without helmets. And interestingly, when you see people on cycle paths, it's almost like, because I'm on a cycle path now and there's no vehicles, I don't need to wear a helmet.
Absolutely. And the parents don't wear helmets either. And I think that's hard, because that doesn't set the example to them either. And a cycle path is suddenly safe, and you are safe from being hit by a car, but you're not safe from falling over the handlebars, still going at moderate speed. And and sustaining nasty injuries. And now a helmet won't protect your face. I see quite a lot of children who end up with scrapes and scratches of their face when they come off, but it does protect your forehead and the sides of your heads, which is the most vulnerable place for kind of serious head injuries. And so, yeah, I find it very hard when I am in parks or on the road and I see teenagers or children not to even wind the window down and say something.
Like,
it's really hard. And even children who come into A&E maybe with an arm injury from falling off a bike, I'll say to them, I had a couple of my nights this weekend and I said, were you wearing a helmet? And they'll say, no, but I didn't hurt my head. And you say, well, yeah, maybe not this time.
This time.
Yeah. Next time you might.
It's a chat, and we at Mini First Aid, we run a baby proofing class, which is all about protecting and avoiding the accidents before they occur. And we talk about things like corner protectors, as you mentioned, and looking at different types, ones that are perhaps safer than others because they can't fall off and be a choking risk. And then we get into those really gritty subjects around stair gates, and then on to helmets, and it's sometimes quite a lively debate, and quite often it's because the children will come back and say, I just don't want to. And I think that line where you said, if you want to be on wheels, you've got to wear a helmet, is really, really important.
Parents don't want to deal with the tantrum that ensues after. I've seen it in my nephew. He's 3. We went out with my sister the other day and he didn't want to wear his helmet. He wanted just to go on he's got a balance bike. And I said to my sister, I was like, it's really hard because he's going to have a complete meltdown now. But you have to be hardline about this. You do. Yeah.
Lily, this has been so helpful, and I think it's really, really important that parents have this opportunity to hear this information about head bumps, because it's a really worrying time when you have small children, and as they get older, things happen and we sometimes second guess ourselves, are we doing this right? So I think it's really, really helpful to hear from a professional like you about the fact that we're not wasting time if we go to A&E, but also some of those key things to look out for head bumps. So just if there was one thing that you would want, there's been lots of things today, there's probably loads that we could pick from, but if there was one thing that you would like our listeners to take away from our conversation about head injuries, what would you want that to be?
I think it's knowing that head injuries are important, that even a relatively minor head injury, can lead to some symptoms and some damage, and knowing where to look for the advice that you need to be able to assess them. And as you said, you do amazing work with Mini First Aid. There's loads of first aid courses that provide parents with a little bit of information, but also online there's some really good resources. So NHS has some advice, but also Healthier Together has a head injury advice leaflet that we give out to everyone. And also I think it's the Children's Brain Injury Trust, they have an advice leaflet which is called the ACORN leaflet, which is all around activities and going back to normality after a concussion. So it gives you the kind of stepwise fashion of how to get your child back to normal when they have had a concussion or a head injury. And I find that super helpful to give to parents, because it talks about things like minimizing screen time, maximizing sleep, when to keep them off school if they've had a serious head knock, how long you need to be off contact sports. We see a lot of boys playing football or rugby who have head injuries. And it's actually more severe than you might think off the cusp, and I get a lot of teenage boys who may be playing rugby who I say, you've had a significant head knock, you now need to have 2 weeks off contact sports, you need to have 24 hours where you don't watch any screens, play any video games. And I get a lot of eye rolling, but it's that talking about that injury to the brain and how those brain cells may be damaged and they need time to settle down and time to recover. And actually a lot of what we do now in the 21st century is super hyper-stimulating for our brains. And so being on a computer or playing a video game, it requires a huge amount of brain input. And so it's very different to going for a walk out in the countryside or listening to an audiobook or those kind of things. So actually it talks you through what you should do and when, and how children might go back to school. They might need a little bit of time off. They might need a bit of less intense schooling, so like a half day, or no homework for a couple of days. I'm sure that will thrill them, but that kind of stepwise fashion. And so that leaflet called the Acorn leaflet, if you put it into Google, it will come up. And
what we'll do is we'll pop the links in the show notes from today's podcast. So if there are parents, for those 3 links that you've shared there, we'll make sure that they're in the links so that people, if you pop to the show notes for today's podcast, you'll be able to see those and follow them through. That's brilliant. Thank you. Lily, it's always fascinating. It's always fascinating chatting. And in fact, we've got you back to cover another subject with us this series as well, which is absolutely brilliant. Folks, you've been listening to the Family Health Podcast. And if you want to watch the Family Health Podcast, some people like to look at us. Some people need to know what we look like. We have the Family Health Podcast on YouTube, and you can listen to the Family Health Podcast across all of your favourite podcast platforms. And if you hit subscribe on your podcast platform, it means that each week when we bring out a new episode of the Family Health Podcast, it will alert you so that you can have a listen. And I've got a request before we finish today, which is that if there are topics around family health that you would like us to cover on the Family Health Podcast, please do let us know, because what we want to do is deliver you the information that you need most for your family's health and well-being. You've been listening to the Family Health Podcast. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.